The Education Ministry recently announced that it would enforce body mass index or BMI checks on school children aged 5 to 9 beginning March to help curb the national obesity problem. BMI is primarily used to measure body fat based on a person's height and weight. This has received mixed reactions, with some questioning whether or not BMI can be used as an effective health indicator. We deep dive into the issue with Nutritionist Associate Professor Dr. Geeta Appanah.
BMI is used and is useful as a screening tool, but not commonly used as in the actual diagnosis. Yeah. So although BMI can give a snapshot of a person's health based on their weight, it does not account for other important factors such as age, their gender, their sex, like their ethnic group, genetic, muscle and fat mass, and so on. When we were to talk about children, this is slightly different. Yeah, because when their BMI, because most of the time their BMI is being adjusted or being what we call considered for their age and their gender, their sex, due to their rapid development and growth. Yeah. So after BMI is estimated using the same formula as for adults earlier on, when I mentioned earlier on, we take that number and we plot it on a graph. And so obesity in children is actually defined by those curves on the graph. And it is a bit different than obesity in adults, where we can use the absolute numbers.
Childhood obesity is a growing health crisis, says Dr. Geeta, especially among children in lower income groups.
This is a particular issue in children who are coming from a lower socioeconomic group, mainly because they often have more exposure to or access to processed foods, as they are much cheaper. Some parents of these children have low awareness on how to choose or prepare healthy foods. And other parents simply can't afford fresh fruits, vegetables, whole grains, or lean meat because they are quite expensive. Yeah.
Besides tracking BMI, Dr. Geeta says there are other preventative steps that can better tackle childhood obesity.
Keeping track of the measurement is a very good indicator for many people, for health professionals to take action, policymakers to make certain policies to ensure our children are not affected by this obesity problem very much early in their life. But other than that, that's not the only action to curb child obesity, but we have to really do all the other actions. For example, we need to really advise our people, eat healthily, or encourage their children eat healthily, do physical activity, and all of this can have a big role in curbing child obesity.